Next, we are going to have Dr. Nayana Shivamogga with us. She is going to present IOL scaffolding in morgagnian cataract.
Greetings everyone. Here we describe IOL scaffolding technique for phacoemulsification in case of a hypermature morgagnian cataract. After clear corneal incision, anterior lens capsule is stained with trypan blue. Doing rexus in case of a hypermature cataract is challenging. Connecting cystitome with an irrigation fluid line makes the rexus easier as it maintains the anterior chamber and improves the view for the rexus by pushing the liquefied cortex out of the anterior chamber through the tunnel. Now we are injecting viscoelastic to create some space in the bag. Foldable IOL is being implanted below the nucleus in the bag. Nucleus is small in this case, so it is easy to implant IOL below the nucleus. During nuclear emulsification, viscoelastic needs to be injected repeatedly to protect the corneal endothelium. IOL here acts as a scaffold and prevents dangling of the nucleus and hence prevents any posterior capsular rupture. Further, IOL scaffolding keeps the bag distended and prevents any inadvertent zonular dehiscence. Important aspect to be followed in this case is to perform cortex and viscoaspiration below the IOL to avoid entrapment of the liquefied cortex between the IOL and the posterior capsule. Viscoaspiration is being followed by wound hydration. IOL scaffolding ensures safety in performing phacoemulsification in morgagnian cataract. Thank you.
So you think it's
What was the need of IOL scaffold in this?
So usually when
That we can manage with the viscoelastic,
it's make it a little more safer, I think.
but it will decrease the space, working space, and you are close to the endothelium. And
that is true, sir. But in this case, this was a hypermature cataract. So, in the when we try to attempt a phacoemulsification in this case, it is possible that the nucleus might become vertical, and we might catch the capsule inadvertently, and PCR chances are also more. So, once I injected the foldable IOL, the phacoemulsification was more stable. But it is true that corneal endothelium has to be taken care of. So dispersive viscoelastic always helps, and this is a safer technique in case of hypermature cataracts.
What about the irrigating cystitome? How did you design that?
It is just a regular 26 gauge needle with which we have made the cystitome. We are just connecting it to the irrigation line.
Irrigation?
Irrigation line, ma'am. Just how we do cortex
phaco
aspiration.
machine.
Not the phaco machine, manual irrigation. Just a drip. It's just
I
a drip,
think that
like a
is,
drop by drop.
That is something very useful.
Yes,
I
that
think.
is
Yes.
more useful.
Useful.
I felt
In
that.
such morgagnian cataract, leaking cataracts, I think that is more useful.
But you do it from the main port.
Main incision port.
It's difficult to
phaco-
maintain then
phaco-
space. If you do
yes.
it by side
Side port, yes.
it will be much easier.
Yes.
And you can have a AC maintainer also.
Yes.
I think that works the same way.
Well, it will work the same.
What she's trying to say, that you have a hypomature morgagnian sclerotic cataract, and it's like a wobbly nucleus which is small, and there you fill up the bag and you protect the posterior
capsule.
with a scaffold, IOL scaffold, and then you go ahead with the procedure.
Yeah.
So you have enough space, reasonable space, and you are safe enough not to go here and there. The nucleus, wobbly nucleus can actually move up.
So, but then again, going behind the IOL, giving a wash and everything, you can still, get the PC into trouble then.
Yes. Thank you, sir.
Thank you.